We're here at 800 Adele. This is the dry docked facility, currently a contract dispute between the owners and the Progressive Conservative government, where they vacated the premises but continue to pay rent. And with me is Robert-Falcon Ouellette, who's the Member of Parliament. This building falls within your riding, Robbie, and you've been following our stories about this dispute and about the fact that Marion Willis at Moorburg House and other agencies involved in addictions treatment and care in our city, they've developed a theory, proposal that this building should be put back into use, and the area that you're standing in front of has what could be are already equipped, essentially, detox units that can be used for meth treatment programs and recovery. And I wanted to get your perspectives on this dispute and on the fact that these units are sitting vacant here in Winnipeg.
So we know that we have a huge meth crisis in the city, also a trauma crisis going on, mental health, and we need to find ways of dealing with that. The federal government, we have put $200 million towards the province. We're hoping the province will actually take that money and actually spend it on the mental health of our fellow citizens, as well as $4 million for addictions treatment and $12 million to the Winnipeg Police Service for more data collection and trying to find out how they can better do their operations and try and support them in what they need to do. But this also could be an interesting facility to have in part of the addictions treatments, because what we know is actually meth requires a longer treatment period. It requires a much more counseling and a much more supportive environment, starting with detox to short, medium, and very long term, up to almost 2 years. And we're not very well equipped in Manitoba. We don't seem to be having an overall plan about what we should and shouldn't be doing. So it'd be really wonderful to have a facility like this. Obviously, at the same time as well, we should consult with the local community, because this is in a neighborhood around here on Adele and just on Arlington. So we should probably sit down and talk with local community members, talk about a little bit about safety, about some of the long-term plans, how this will all fit in, and make sure that people feel secure that if the facility did come here, that their needs are also met, because it's not also just about individuals who might have addictions, but it's also about ensuring that you look after the entire community, that the community's needs are also met.
So in general, notwithstanding the contractual dispute that the provincial government's involved in principle, you'd like to see these detox units that are available in this facility put not just like on the open market, but put directly into use as part of a meth treatment regime by the province.
Well, I studied this with the health committee at the House of Commons in Ottawa. We traveled across the country. I was in Calgary. They have a continuum of care. They start with detox wait periods anywhere between 1 to 3 days, and then they have a continuum of care afterwards for short, medium, and long term, trying to place people in residences that are supported, that people don't fall back in bad habits, and just looking after the healthcare of citizens. But we don't have that in Manitoba, and it's really important because right now Addictions Foundations Manitoba has very long wait times, much longer than what we have in other parts of the country. And as Canadian citizens, we deserve to have access to healthcare, especially healthcare which like addictions, which has such a major impact on the people around us. And people know of the issues that we're facing, the security issues, and I was just talking about that with the West End Biz, the downtown biz. We were talking about security issues today, about how we can work together. But this could be one of the arrows among many others that we could be using in order to get more people into treatment, because we know there is a lack of beds. We could actually be making sure this place is filled up so people can obtain treatment that they need, that they can obtain treatment that leads to long-term success. And obviously we need partners at the provincial level to do that, and I'm willing and ready to have discussions with the health minister at the federal level to see what we can do to get more dollars. But we need the province to sit down and come up with a plan, show us the plan, and because they control the healthcare system. What are they going to be doing? How are all these little systems, the police, the detox, the healthcare system, harm reduction with needles, how is all of this going to work together? And also the educational component with our kids in high schools. How are we making sure that kids aren't getting on drugs in the first place? So anyways, there's a lot going on. This is going to be part of it.
Robert-Falcon Ouellette, the Member of Parliament for Winnipeg Centre, thank you so much for taking time today to join us.
You're welcome.